As of the recording of this video, it's been about 24 hours since Damar Hamlin collapsed on the field after making a tackle and momentarily getting to his feet and then falling back down. In all probability, what he experienced was something called commotio cordis, which led to his cardiac arrest. Had it not been for the immediate medical attention, including the use of the AED, the automated external defibrillator, to shock his heart rhythm out of ventricular fibrillation and into a normal heart rhythm, he would not be alive today. Right now, he remains in critical condition in the intensive care unit at the University of Cincinnati Medical Center. Jordan Rooney, who is Hamlin's agent, said that Hamlin was awake before he was sedated to put a breathing tube in his throat at the hospital. Why is that significant? Whenever a patient comes to the ICU after experiencing a cardiac arrest, we almost always intentionally make sure that the patient is cold, specifically to a temperature of 34 degrees Celsius or 93 degrees Fahrenheit, which is typically done for 24 hours. This is called therapeutic hypothermia, aka targeted temperature therapy. Now, the purpose of doing this is to cool the brain, which slows metabolism down in the brain. That's in order to prevent or minimize the chances of sustaining brain damage as a result of the lack of oxygen during that cardiac arrest. So it's basically to mitigate the potential for hypoxic brain injury or what's called anoxic brain injury. Basically, cooling helps to mitigate damage to the neurons after they've sustained that anoxic brain injury. But if the brain does not have injury after the cardiac arrest, there's no need to cool the brain. So if Damar Hamlin was awake after the cardiac arrest, that's a good sign, at least as far as the brain is concerned. It also means that there would be no reason for him to have therapeutic hypothermia in the ICU. Dorian Glenn, who's Hamlin's uncle, told a reporter earlier in the night that Hamlin was resuscitated twice. Once was on the field, and then once was actually at the hospital. He also said that Hamlin has lung damage, but called it a good sign that Hamlin is breathing only 50% oxygen on the ventilator, down from 100% oxygen on Monday. That's according to a Syracuse.com report. It's fairly common for a cardiac arrest patient to have lung damage. This is something called acute lung injury, also known as acute respiratory distress syndrome, if it's very severe. Basically, the lungs in this situation, they become very inflamed and they fill up with fluid. Now, in some instances, when it is severe, it becomes really hard to get enough oxygen into the bloodstream. But one trick that we have is to improve this by actually flipping the patients onto their stomach, which usually ends up improving their oxygenation. One of the issues with flipping someone on their stomach while on a ventilator is that it requires fairly heavy sedation or a medically induced coma, if you will. And sometimes patients require a medication that temporarily paralyzes them in order to make sure that their diaphragm is in synchrony with the ventilator, which is to say that we need to have complete and precise control of their breathing so that their body does not accidentally fight the ventilator, so to speak. So with having patients with moderate to severe ARDS be in the prone position, which is to say that they're lying on their chest, and while having complete control and precise control of their breathing, we're generally able to improve their oxygen levels. The reason the prone position helps in this instance is that it actually alters the mechanics and the physiology of gas exchange inside the lung. Normally when someone's on a ventilator, you're lying on your back. Now in this situation, the weight of the diaphragm and the heart ends up partially squishing the bottom portions of the lung, especially the part of the lungs that are closer to your backside. So in this position, not only is there slightly less blood flow reaching that portion of the lungs, but the alveoli in this portion of the lungs, they're not allowed to fully open. So basically, you're not going to get as good of oxygenation. Normally, this is never a problem. Right now, if I were lying on my back, that's not an issue. But when someone has a lot of inflammation in their lungs, to the extent that lungs are having a hard time getting enough oxygen into the bloodstream, laying in that position becomes less than ideal. So when you flip a patient onto their stomach in that prone position, you usually see an improvement in oxygenation. Overall, prone ventilation has been shown to reduce mortality in patients who have moderate to severe ARDS who are managed with low tidal volume ventilation. And it sounds like that is exactly what happened with Damar Hamlin, as his oxygen was cut from going from 100% down to 50%, so that in itself is a good thing, at least from a pulmonary standpoint. Now, once we're able to improve the oxygen levels, typically once we get it down to around that 50% mark, that's when we feel more comfortable to flip that patient onto their backside, because we don't want patients on their stomach for too long in that prone position. Why? Because that has the potential for other consequences, such as pressure ulcers that can develop on the body, including on their face, and then tubes and lines, they can come out of the place. For example, if you have a central line that can come out of the vein and so forth. So you never want tubes and positions to come out of position, and that's always a risk when patients are flipped onto their prone side. So when the patient starts requiring less support from the ventilator, we like to decrease or wean down the amount of sedation that we give patients, especially because we want to assess their mental status. We want to assess their brain function. You can't really assess brain function if they're receiving sedative medications. But again, the fact that he was awake before receiving sedative medications is very telling, and when it comes to the brain, that's a very good sign. No doubt about it, Damar Hamlin is receiving top-notch medical care at University of Cincinnati Medical Center, and I remain very optimistic and hopeful that he progresses in his recovery.